Some of the meds you take can actually treat you. Could be the reason for your blood destruction? Some medications have been associated with blood problems because they target the bone marrow, where your blood cells are made. Today, we will talk about the most dangerous types of medications that prevent your body from producing blood cells, especially if you have anemia or suffer from constant fatigue and dizziness. Follow me until the end. How are blood cells produced? Your body makes red blood cells in the bone marrow, which is inside large bones. Any medication that affects the bone marrow can prevent the body from producing blood, causing severe anemia, fatigue, and immune deficiency. Let us now talk about the most common medications that can cause this problem. Number 1. Cancer medications. Chemotherapy is designed to destroy cancer cells, but it also targets rapidly dividing healthy cells, including blood cells. Chemotherapy drugs such as doxorubicin, fluorouracil, and many others can cause a decrease in the production of blood cells. This can lead to anemia, easy bruising or bleeding, and a weakened immune system, making it harder to fight off infections. Number 2. Powerful antibiotics. One of the powerful antibiotics that can cause blood problems is Linezolid uniform, also known as Linezolid. It's used to treat serious bacterial infections. When used for a long time, it can cause a type of anemia called sideroblastic anemia. This means that the body has enough iron to make hemoglobin, the part of red blood cells that carries oxygen, but the body can't use the iron properly. Also, it can cause thrombocytopenia, a condition in which the body doesn't have enough platelets, which are responsible for helping with blood clotting. Number 3. Immunosuppressants. Certain immunosuppressant medications used to prevent organ rejection after a transplant can interfere with the production of blood cells. These include azathioprine and methotrexate costume. These medications suppress the bone marrow, which can lead to a decrease in the production of red blood cells, white blood cells, and platelets. No. 4. Viral medications. One of the most well-known medications that can cause spinal suppression is Zidovudine, which is also known as Retrovir. This medication is used to treat HIV infection. When used for a long time, it can affect the bone marrow, leading to a decrease in the production of red blood cells and an increase in the risk of anemia. No. 5. Medicines for epilepsy or psychosis. Certain anti-epileptic drugs and antipsychotic drugs can sometimes cause hyperproteinemia, which is a condition in which there is a low level of protein in the blood. This can happen when the body does not have enough protein or when the body breaks down more protein than usual. Drugs used to treat epilepsy, such as Carbamazepine and Clozapine, have been linked to this condition. When do you know that the problem is due to medication? If you are taking any of the medications mentioned and experience the following symptoms, you should see a doctor right away. No. 1. Constant fatigue despite rest. If you're constantly feeling tired and worn out, even after getting enough sleep, this could be a sign that your body isn't making enough red blood cells to carry oxygen to your tissues and organs. This is a condition known as anemia. Number 2. Dizziness and paleness. If you are often feeling dizzy and lightheaded, especially when standing up quickly, this could be a sign that your blood pressure is dropping because your body isn't making enough red blood cells. You may also notice that your skin and the whites of your eyes appear pale. No. 3. Recurrent infections. If you find yourself getting sick with infections very often, it could mean that your immune system is not working properly. A decrease in the number of white blood cells can make you more vulnerable to infections. No. 4. Bleeding from the gums or nose. Easy bruising or bleeding from the gums or nose can be a sign that your body is not making enough platelets. Platelets are responsible for helping your blood clot when you have an injury. You can perform a complete blood count test to check if you have a problem with your blood cells. If you have any concerns, make sure to speak with your healthcare provider. What to do if you develop symptoms of anemia? Don't be afraid. Not all of these medications affect everyone, but you must be aware. Number 1. Monitor your blood during long treatment. If you are on long-term treatment with any of these medications, it's important to monitor your blood cell counts regularly. Your doctor may order a complete blood count test every few months to check for any changes. Number 2. Do not stop any medication on your own. If you are experiencing symptoms of blood problems while taking these medications, do not stop taking the medication without consulting your doctor. It's important to work with your healthcare provider to find the best solution for you. Stopping these medications suddenly could be harmful to your health. No. 3. Your treatment may be changed. Depending on the severity of your symptoms, your doctor may decide to change your treatment plan. This may involve giving you a different medication or adjusting the dose of the medication you are currently taking. No. 4. Medicines are not the only treatment. There are other forms of treatment that can help stimulate the production of blood cells. For example, you may be given a nutritional supplement such as folic acid, vitamin B12, or iron supplements to help improve your blood cell counts. In some cases, a blood transfusion may be necessary to replace the blood cells that are not being produced properly by your bone marrow. Thanks for watching. Please share the video with anyone you know who takes chronic medications. Write to me in the comments, did you develop symptoms of anemia during treatment? Don't forget to like and subscribe to the channel for more health and awareness videos. See you next time.